India reports 37,875 new coronavirus cases, 369 deaths. 69% of cases are still from Kerala, but Kerala is now seeing under 29,000 daily cases. The state has lifted the night curfew and Sunday lockdown. A Maharashtra minister and the mayor of Mumbai have said that Maharashtra is seeing the onset of a third wave. This after cases rise in Nagpur and Mumbai. Despite being a front-runner in COVID-19 vaccinations, Israel is now one of the world's biggest pandemic hotspots, reports the highest per capita caseload this week, according to global data. As of September the 6th, though, around 28% of Israel's population had even been given booster shots. Hello and welcome. You're watching Coronavirus Facts versus Myths. I'm Rishika Barua. Last week, the World Health Organization classified Mu as a variant of concern. Now, the Mu variant, or the B1621 as it's called, was first found in Colombia. It's now spread to over 40 countries. The World Health Organization has classified it as a variant of interest, because of the genetic changes that are being predicted in this particular mutation. And these genetic changes essentially affect the virus's characteristics such as the transmissibility, the disease severity, as well as the immune escape mechanism. Now, Mu hasn't been found in India just yet, but the US had reported the peak of COVID-19 cases due to Mu in mid-July. So, the Mu variant cases peaked in the US in mid-July, and in the UK too, cases are being reported that are linked to the Mu variant. So, what is this new variant of interest? Remember, it was first discovered in January 2021 and it's only been termed as a variant of interest in August, or rather the beginning of September, by the World Health Organization. So, what more do we know about this variant, even though it's been around for the last 6 to 8 months? Why now has it been termed as a variant of interest? To try and understand all of these things, we have Dr. Ishwar Gilada, consultant in HIV and infectious diseases, the Secretary General of Organized Medicine's Academic Guild, with us. We also have Vikram Talaulikar, senior clinical lecturer at UCL, joining us from London. Thank you very much for being with us on this edition of Facts versus Myths. Dr. Vikram, if I can begin by asking you, the Mu variant has been around, like I said, for over 6 months. It's only been deemed as a variant of interest now. Why?
I think it depends on what happens with the strains and what sort of outbreaks happen whenever a strain becomes sort of known to the world. So far, the Mu was circulating in the environment, circulating in different populations, but it hadn't caught attention simply because the number of cases or the outbreaks it was causing were sort of sporadic. It was affecting mainly South American population, then it went to America, California, Florida. We've got about 50 plus cases here. And so there have been sporadic outbreaks, not something like what we've seen with the Delta variant, which just overcame any sort of barriers which were there for checking the spread of the coronavirus. So whenever the outbreaks happen, that's when the genomic surveillance starts becoming more and more active. And it's now that we've recognized that Mu variant is circulating. So far, it's much less than the Delta. It looks like it's not yet having the same capacity of spreading as Delta. But the scientists will be keeping an eye on it, whether it's in UK, rest of the world, or US, they'll be keeping an eye on it to see whether it is actually really more transmissible. Is it the one that can escape vaccine? So far, things don't look like it's going to be much different or more severe than the Delta.
All right. So far, it doesn't look like it's going to be more severe than Delta. But Dr. Gilada, I think one of the big red flags, so to speak, with this Mu variant is to do with its immune escape mechanism. Now, this is something that the WHO has warned, that it could be more vaccine resistant because it's a constellation of virus mutations from what the WHO has said in this epidemiological review. How do you look at this new variant of interest and the million-dollar question on whether vaccines will be effective against it?
Yeah, basically, currently Pfizer vaccine is not working on this kind of variant, and WHO is keeping eye on 5 different variants of interest. They also think that possibly this might go in from variant of interest to variant of concern, and therefore, because it has spread to 40 countries and barring Nebraska, all 49 states of USA.
Yes.
So it is going that way. Currently, though, the contribution of this variant in the entire world is only 0.1%. But if you remember, Delta was also 1% in January. From January to July, it became almost 100%. So 1 to 100, it can become. And there is hardly little difference between 484K and Q. Basically, it is what you call R484, no, E484K is this variant, and Q is Delta. But with little variance, little difference, Delta has done such a havoc all over the world. So they are keeping it watch. And if it is immune escape, vaccines are not working, then you will have to either modify the vaccine or you will have to have different vaccine. So we don't know whether other vaccines like AstraZeneca will work there, because most of the people have been using Pfizer there and Moderna there, and Pfizer is having immune escape there.
All right, so there is evidence linked to immune escape as far as Pfizer is concerned. Dr. Vikram, what about natural antibodies? When we talk about the immune escape tendency of a new variant of COVID, it essentially means that even someone who has antibodies as a result of the past infection can get reinfected?
Yes, infections can always happen. A person who's been immunized or has had natural infection previously with any strain of COVID can go on to have another infection with COVID, whether it's the same strain or another strain. The important thing to see is how bad the infection will be. So having infections, rise in cases will happen from time to time, especially in winters. All countries will see an increased caseload with infections and cases. As long as those cases do not result into hospital admissions or deaths, that is what the vaccine is about. It's going to prevent the severity of illness. Again, so far, all the strains which are circulating around do seem to be responding to the vaccines. We, of course, need dedicated special studies about the mu variant. It's a new variant. We are studying more about it. We'll know in future. But so far, the evidence on ground still says, if you had natural infection or immunization, both doses, you're certainly guaranteed some sort of protection against most strains which are around. Okay. So the mantra is still the same. Get your vaccine if you haven't. And if you've had natural infection, it would still be advisable to complete your vaccination whenever it's offered to you.
Right. Dr. Gilada, one of the reasons why, there have been some red flags with this mu variant, even though it's a variant of interest right now and not a variant of concern according to the WHO, is that it was first found in Colombia in January 2021, and if you look at the way the variant has spread in Colombia, 39% cases in the Colombia region are currently attributed to the mu variant, and like Dr. Vikram was pointing out, that's exactly the trajectory that Delta followed as well. The first Delta reported in India in October, and then we saw the havoc that it wreaked with the second wave.
Yeah, that's the reason they are watching it with very much interest. But if you look at in Colombia, now Colombia, it is not so much presence as much as in other 39 countries. So in January to this month or last month it increased, but thereafter it is not so much in Colombia. Secondly, it has not caused so many deaths. Only problem is that it has two variants, which are also the variants in kind of a beta variant. That is E484K and K417N. So beta could create havoc in South Africa and lot of immune escape. Beta had an immune escape both for AstraZeneca as well as Pfizer. So if it goes to beta way, then also there is a problem and it might become a variant of concern. So we are keeping a watch on it.
Right. Dr. Vikram, this terminology, variant of interest versus variant of concern, if you could just shed some light on that. We know that there are currently 5 World Health Organization labeled, variants of interest: Eta, Iota, Kappa, Lambda, and now mu. What qualifies as variant of interest, and at what point does the variant of interest become a variant of concern?
So the terminology is that the variant of interest is whenever the virus mutates and it acquires new mutations. And that's a sort of a property of viruses. They will keep mutating all the time. Some of them will be not beneficial for the virus, so the virus will die out. The others will make the virus more transmissible. Those are the ones which survive. And this will keep happening years and years and years after. So once the variant is emerging and it's got some new mutations, that will be a variant of interest. And that gets picked by the genomic surveillance, which all the countries are doing. The variant of interest means something new has been identified. That's the important bit. Right. Now, variant of concern happens when it's proven that that particular variant is now either increasing the transmissibility or it's increasing the virulence, causing severe disease more than the previously known variants, or it's actually escaping the protection from vaccines.
Okay.
So the concern happens when there is obvious clinical evidence that now there is definitely increased transmissibility, increased caseload resulting in deaths or disease, and of course it's escaping vaccines. They're not being effective as before. So that's the difference between the two. So variants will emerge. Of interest will keep happening. This is what the scientists are doing. They're keeping a close eye on the genomics and how this transmissibility happens. When it becomes concern, it will be when the actual epidemic starts or the pandemic spreads.
Dr. Gilada, enough being done in India to be able to identify and contain new emerging variants. We know that our genomic surveillance, is a very tiny percentage of even our target. We're not even meeting that 5% target that the authorities have set out for themselves. So are you worried that we're not doing enough genomic sequencing in India to better be able to identify and contain new emerging variants?
Genomic sequencing is a very tedious procedure and it is an expensive procedure. Per sample, it costs around 10,000 rupees. So, recently it has been also established in Mumbai city. So we have become better than earlier, but I don't say that we are closer to anyway to 5%, not even 1% now. But we will keep a watch, and whenever particular variant of interest becomes a concern, then we should keep better watch. Currently, with the limited resources, I don't want to say that we should invest a lot of money in genomic studies because we have a lot of other compulsions. But at the same time, we should keep a watch and more centers should open. Secondly, if you look at earlier about Delta variant, after 2 months we are getting report. So by that time, the havoc keeps on happening. Now at least we are able to get report in 8 to 10 days. So that is also very important when you get reports.
So you're saying the process of genomic sequencing also is something that needs to be looked at. We need to expedite reports in order to be able to contain the spread quicker. Well, thank you both very much for joining us. This conversation has indeed been useful. This variant thankfully hasn't been detected in India just yet. But then there are several questions on whether we are doing enough to actually detect new emerging variants here. But thank you very much for joining us.
Thank you.
Well, let's shift our focus now to the other important development. A cabinet minister in Maharashtra government and the mayor of Mumbai have in separate comments talked about the possibility of the onset of a third wave in Maharashtra. Now, Mumbai cases are up 55% as compared to what they were 2 weeks ago. Cases have seen an uptick in Nagpur as well. 150% spike in the last fortnight, even though in absolute numbers, the cases continue to remain low. What should we make of these comments about the onset of a third wave? We've heard from the administrators and the politicians. Let's also hear from a doctor. We have Dr. Avinash Bhondwe, senior physician and former president, IMA, Maharashtra State, joining us. Thank you very much, doctor, for being with us. Very simply put, there are two separate comments that have come in from the mayor of Mumbai and a Maharashtra cabinet minister talking about the fact that this is the third wave that we are seeing in Maharashtra. Would you agree?
Actually, the comment which was made or the decision which was announced by the Honorable Minister, Mr. Raut at Nagpur and Mayor of Mumbai was, I don't think it's a scientific thing because this Health Minister of Maharashtra State has already talked about it, that there is no third wave right now in Maharashtra, not in Mumbai, neither in Nagpur. Yeah, I must say there are, if you see the second wave of COVID, the number of cases in Maharashtra are going down. Only thing in last few days, you must see in the month of August, the number of cases were not going to the lower side. They were remaining steady around 4,000 to 6,000.
Right.
Now it is coming down. And in such, this is called as a flattening of the curve. But in such cases, there are always seen, if you see the epidemiological history, there are always upsurges at certain level. So whatever we are observing at certain places like Mumbai, Pune, or some regions even in Nagpur, there are upsurges. They go up.
No,
and again they will go down.
the reason I'm even asking you this question, and the reason, it warrants clarity at the moment, is because that's exactly how the second wave started. If you recall the trajectory, there was an upsurge in cases. At that time, we were still figuring out the Delta variant. We know that Delta variant was localized to Amravati, Vidarbha regions. It then gradually spread across the state of Maharashtra and, of course, all over the country. What we're seeing right now is a uptick in cases in Mumbai and an uptick in cases in Nagpur. And like I said at the very outset, this isn't also very high in terms of absolute numbers. But isn't this the way it starts, Doctor? And can you clarify whether you are concerned about these two areas right now?
With a study of epidemiology, I will give few points. There are 4 major points. The first is in the natural history of any pandemic, the coming of all these first and second, all the waves is a common thing. So third wave is going to come. Now the problem is it must start any new wave must start with a new variant. It is not the old variant again going up. It never happens. So the new variant has to be there. Right now in Maharashtra, we have seen the variant of Delta virus, which is called as Delta Plus, was found at certain places, especially in Ratnagiri and Jalgaon. The number of cases were very high. And the Maharashtra government started the genome sequencing in the sampling type of way. Every district will send 100 samples every month. The percentage is low. As you discussed some time back, that percentage is low, but that will definitely give some idea that the new virus is increasing. In last time when we discussed, at that time the government was not even ready to accept that there is a new virus which is there in Maharashtra. So now the government is very much aware, and they are absolutely they are keeping a very close eye. The third more important thing, which is very worrying, these are external factors, that the controlling measures by the government, usually like test facilities, increasing the testing, the contact tracing, the genome sequencing, all these things are now not very up to the mark. And the fourth most important thing in which a wave appears is again there are chances, because observing all the appropriate behavior, all the important preventive aspect, this is not seen by the common people.
Are you worried specifically about Mumbai and Nagpur very quickly, given the fact that we are going into festival season? This weekend is Ganesh Chaturthi. It's a big festival in Maharashtra.
Right now, Ganesh festival will be there day after tomorrow, and it's a very big festival, not only in Mumbai or Nagpur, it is everywhere, in Pune, in Satara, all the districts. The Ganesh festival definitely occurs. The government has given proper instructions. But as you know, few days back there was the Dahi Handi, this thing like after the Janmashtami. It was rather some political parties observed it without, they didn't follow the government's instructions and restrictions, and it was there. In addition to that, there are political rallies and social activities are going on. So this factor, the fourth factor, which is depends on the people, it again shows some that there will be, if suppose we get a new variant, then on government side there is laxity, on people side they are not following all these things. So the third wave will definitely come, but for that we'll have to get this new variant in a larger amount, which is not being seen. So it will happen. That's why the projection is that it will happen in a month or two, maybe by the end of October. It may take 2 months, but at the same time, all these things are carried out with some discipline, some scientific factor, like government increases the testing and all these micro containment zone and other things. And also people start observing all these COVID appropriate behavior. Then definitely if even the third wave comes, the number of cases will be less. And of course, if we increase the vaccination, the severity of this condition will be less. Of course, the death rate will go down.
Yes, well, I think those are very important clarifications amid, all of the talk of the third wave. I think the doctor there clarifying that this isn't indeed just yet the onset of the third wave, but we have to up the caution and not let our guard down come festival season, and especially in Maharashtra, big festival coming up this weekend. We'll keep a close watch on that story. Thank you very much, Dr. Bondwe, for joining us.
Thank you.